Two new studies have been published that support the use of psilocybin for depression and anxiety in those affected by cancer. They appeared in the Journal of Psychopharmacology, with one study at Johns Hopkins University and the other at New York University. There are some differences in their design, but they share a double-blind, placebo-controlled crossover style. This means participants were split into two groups and went through two sessions, once with a placebo and once with a psychedelic dose of psilocybin. Neither the study monitors nor the patients knew beforehand what was being administered on any given session. During the experience, participants were in a comfortable, familiar room, they could wear eye shades, and they listened to calming music. They were also screened for mental illness and carefully selected for the studies, so the results cannot be generalized to the whole population. As we will see, the results were very encouraging. Since the studies were phase 2 clinical trials, they lay the foundation for phase 3 trials, which are already being planned. I'm going to briefly run through the key results and the basis for the research before getting into the details. The primary finding was that 60 to 80% of patients with or without psychotherapy had a significant decrease in anxiety and depression that lasted up to 6 months or longer. Participants reported feeling more optimistic, they had an altered relationship to their own mortality, and they felt their lives were more meaningful. All of those effects were possible without any significant negatives. At most, there were brief periods of anxiety and paranoia, as well as nausea and headache. In both studies, the positive outcomes were frequently correlated with ratings of mystical experience. Those who had mystical, reorganizational, or unity experiences were more likely to have positive outcomes. As we've seen in other studies, it was common for participants to say the psilocybin experience was one of the most meaningful experiences of their entire lives. So what's the basis for this research? Cancer is known to cause anxiety and depression, with one estimate being that around 40% of cancer patients have a mood disorder. Those conditions are connected to a lower quality of life, potential negative effects on physical health, reduced treatment compliance, and an increased risk of suicide. Current treatments include psychotherapy, antidepressants, and anxiolytics. Unfortunately, research generally doesn't support antidepressants having much effect. Both drugs and therapy can take time to have an impact, and neither tend to deal with existential distress. It's rare for patients to receive treatments that adequately address the hopelessness and demoralization associated with cancer. Treating comorbid psychiatric disorders leads to a higher quality of life in cancer patients and should therefore be an important part of treatment. Evidence for psychedelics affecting depression, anxiety, and other conditions is plentiful. Testing in cancer patients began in the 1950s and 1960s. The early studies weren't high quality, but they suggested psychedelics could reduce depression and anxiety based on the results of hundreds of participants. Papers published in 2011 and 2014 showed psilocybin and LSD may reduce psychological distress in cases of life-threatening illness, and a trial published earlier in 2016 had promising results for treatment-resistant depression. Research also exists in support of serotonin receptor-based anxiolytic and antidepressant activity. Downregulating or otherwise inhibiting 5-HT2A in rodents is associated with decreased anxious behavior. 2A density in some parts of the brain has been correlated with anxiety in humans. 2A expression appears to be increased in cases of depression and suicidality, and SSRIs are associated with 2A downregulation. Other glutamatergic and BDNF activity from serotonergic drugs may play a role in reducing depression. When this information is combined with the minimal safety concerns of psilocybin in controlled settings, it seems like an obvious drug to test if you want to reduce anxiety, depression, and related mood disorders. With this basis in mind, let's explore the latest studies. We'll start with the Johns Hopkins study, which is the larger of the two. It involved 51 patients who'd been given a potentially life-threatening cancer diagnosis. They were initially provided either a full psilocybin dose of 22 or 30 milligrams per 70 kilograms, or they received a very low dose of psilocybin, either 1 or 3 milligrams per 70 kilograms. About 5 weeks after the first session, the participants switched and were given whatever they didn't receive the first time. The study monitors who were with the participants did not provide psychotherapy. Rather, they simply instructed them to focus on their internal experience and to trust let go, and be open. The study was looking at a few things. How will the drug impact anxiety and depression? How will it impact other psychiatric symptoms, mood, attitude, and spirituality? And how will ratings from community observers, such as family members and friends, be affected? The study yielded no serious adverse effects. Moderate blood pressure increases were common. 15% had nausea or vomiting. Some form of temporary psychological discomfort occurred in 32%, compared to 12% for the placebo. Anxiety was present in 26%, versus 15% with placebo, and one person had a temporary episode of paranoia. No prolonged psychosis or HPPD was recorded. Psilocybin produced large and sustained effects on the two primary outcome measures, and on most other measures. The active dose led to significantly greater personal meaning, spiritual significance, and increased well-being or life satisfaction. A strong correlation between mystical experience scores and some of the positive effects was seen. Even after controlling for the overall intensity of the drug, specifically having a so-called mystical experience was correlated with positive ratings for anxiety, depression, meaningfulness, spiritual significance, and life satisfaction. 78% had less depression at 6 months, and 83% had less anxiety. 65% of participants returned to a normal depression range by the end of the study, and 57% returned to a normal anxiety range. Over 80% reported at least moderately increased well-being or life satisfaction at 6 months. That change fit with the results from community observers, who also reported participants were functioning better than before in many cases. 2/3 of patients rated the experience as one of the top 5 most meaningful in their lives. Let's move to the NYU study. It included 29 patients and differed from the previous study in a couple ways. First, psychotherapy was provided in conjunction with the drug, and second, the placebo was niacin instead of psilocybin. Participants initially received either 0.3 milligrams per kilogram of psilocybin or 250 milligrams of niacin during the first session. They switched around 7 weeks later. Like in the other study, the primary outcomes dealt with anxiety and depression, while the secondary outcomes covered things like existential distress, quality of life, spirituality, mystical experiences, and behavior. The results were discussed during Horizons 2016, so here's a brief clip from that event.
And what we found is before the crossover up to 7 weeks, you can see here when individuals get psilocybin, there's an immediate reduction here in anxiety. And you can see the placebo group here has a bit of a reduction, but it comes all the way back up. And you can see there's a big separation between these two groups. Same here, and we see it here for depression again. The moment they get the psilocybin, there's a big drop in depression. It lasts this way for 7 weeks, and there's a big difference between the two groups. So there's an immediate and substantial and enduring effect. And this actually, here, these are D or Cohen's D's. They measure the effect size, the relative difference between the two groups. And anything over 1 is a really, really large effect. So these were very powerful effects. And this is the 8-month snapshot. So you can see someone gets psilocybin, and look, 8 months later, they continue to have clinical benefit. And that really, now after the crossover, it gets harder to attribute that to the psilocybin, but that's a big deal in psychiatry, that something would work so quickly to have anti-anxiety and antidepressant effects and would last as long as several months.
None of the acute negative physical or psychiatric effects were serious. Blood pressure and heart rate were commonly elevated. Headaches occurred in 28%, and nausea occurred in 14%. For the psychiatric effects, 17% had transient anxiety, and 2 people had temporary psychotic-like symptoms. Significant declines in anxiety and depression were seen immediately after the session and until the end of the study, meaning the effects appeared to last more than 6 months. 83% of the psilocybin first group had an antidepressant response after the first session, compared to 14% for niacin. 58% had an anxiolytic response, with niacin again yielding 14%. This suggests that for at least 7 weeks after a session, psilocybin is significantly more effective as an antidepressant and anxiolytic than placebo. By the end of the study, 60 to 80% of participants had a positive response on the primary outcome outcome measures. The scores for the psilocybin first group were somewhat better than for those who initially received niacin. It'd be interesting to see if this correlation continues to appear and if it means an initial disappointing experience reduces the overall treatment outcomes. On the secondary measures, there was a decrease in demoralization and hopelessness, as well as improved spiritual well-being and quality of life. Those effects persisted from 2 weeks after the session until the end of the study. Psilocybin produced other positive persisting effects on attitudes about life and self, mood changes, behavior, social effects like increased altruism, and spirituality. Those effects were seen both before and after the crossover, lending support to them being a true drug effect. Anxiety about death was not reduced, but over time, there was an improvement in attitudes and adaptations towards death. 52% rated it as the singular or one of the top 5 most spiritually significant experiences. 70% rated it as the singular or one of the top 5 most personally meaningful experiences, and 87% attributed an increase in life satisfaction or well-being to the drug. The same kind of correlation between mystical experiences and positive outcomes was seen. Psilocybin, based on these studies and prior ones, does seem to offer lasting anxiolytic and antidepressant effects in the majority of patients. When the positive effects are present, they're correlated with mystical experiences. The importance of that kind of experience has been discussed for decades, including in LSD psychotherapy trials from decades ago. We've seen the same kind of correlation when looking at psilocybin for tobacco and alcohol addiction. Going by the latest research, it appears the drug offers immediate anxiolytic and antidepressant effects, and it doesn't seem like psychotherapy is a necessity, or that study monitors need to have a significant formal background in psychotherapy. Both of the trials were limited in a few ways. They only involved a small number of people, and the participants were not representative of the overall population. The placebos and blinding weren't perfect. Granted, that's bound to be a problem when dealing with such an obviously psychoactive drug, and causality is difficult to ascertain after the crossover. We need to learn more about the mechanism behind the efficacy, as well as how important the actual psychedelic effects are. To give you an idea of what the individual experiences were like, I'll walk through and show some of the anecdotes. Dina Bazar was diagnosed with ovarian cancer in 2010. She went into remission after chemotherapy, but her life was severely affected by a growing level of anxiety. "The fear was eating me alive," she said 2 years after her diagnosis. "It was destroying my life." During the session at NYU, she had a vision of her fear as a dark mass under her ribcage, which seemed like it was consuming her. She was able to address the fear and expel it from her mind. A key part of the experience was an overwhelming feeling of love, something that still occasionally presents itself 4 years later. The session had a positive impact on her life overall, enabling her to live a more fulfilling life instead of being paralyzed by fear. "The experience changed how I wanted to live my life. I used to get up, grab a quick snack, and eat it in the car, but I no longer want to be in a hurry. Now I get up an hour early, make a real breakfast, and read my paper. I have made new friends and re-established old contacts." Eddie Merritt's, another NYU participant, gave this description: "In some ways, I feel that I am better equipped to deal with what life throws at me, and to appreciate the good things. I am grateful to be alive in a way that I didn't know I could be grateful. It's a kind of gratitude that's ineffable. I am much more focused on this moment." Here are some other patient responses.
I felt this connection with everything.
I wish I could put it into words, but a sense of a connectedness that runs through all of us.
It was so peaceful and so beautiful.
I also felt a tremendous connection to everyone I've ever met and known in my life.
It was such an epiphany for me. The cancer and the friends and the family and the past relationships and the present relationships, they're all together, you know, and they're all connected.
But I just had gratitude that I'm here, and gratitude for everything, for being alive, no matter what happens.
I find myself so much more connected to everyone and everything. What greater blessing is that? Especially for a person who held herself apart.
Understanding that death will happen and being fully aware of its reality, which I think a lot of people aren't, it enables you to have a happier life, and that's an irony. People would just be so much happier if they would just admit that they were going to die.
I was on the treadmill the other day, and this thought entered my mind, just came through my mind, and it said, I want for nothing. Nothing. That's how it's been. You know, my life is exactly the same as it was before. Could give you the same list of complaints that I had before that, including getting that cancer diagnosis, you know, including everything that I can think of that I don't like about my life, and yet it doesn't matter anymore.
There wasn't a part of my life that it didn't make better.
I have a greater awareness,
I was able to let little things go much easier.
a better capacity to listen,
I could sleep without medication.
to not feel compelled to talk out of neurosis.
It reminded me who I am, but it also made me a better version of myself. I'm one of the luckiest unlucky people. You know, I was unlucky, got cancer, but I was lucky that I was chosen to be in this study. And it did change my life.
One of the encouraging aspects of this research is that the response from key members of the medical community has been positive. I'll briefly go through some of the responses to show how these results have been received. Jeffrey Lieberman, chair of the Department of Psychiatry at Columbia University and former president of the American Psychiatric Association, said, "We do our patients a disservice by not understanding and appropriately investigating compounds with potential therapeutic value because of their prior controversial associations and on their capacity for misuse." Guy Goodwin, president of the European College of Neuropsychopharmacology, said, "The results were very comparable and suggest a clinically important effect. The experience to date gives reassurance that careful administration in highly supportive environments to selected clinical populations does no obvious harm. Hallucinogens are arguably among the most interesting drugs ever discovered, so it is good to have them back in the hands of clinical scientists." There are many other statements along these lines, some of which I've included on the Drug Classroom website at the link below. The statements are useful since they point out areas of research that need to be pursued and questions that need to be answered. For the most part, published responses to the results have been positive, though many people recognize a lot more research needs to be done. A couple people have voiced concerns about psilocybin due to the potential for it to follow a cannabis-like path. I personally don't view that as a legitimate concern, and it definitely should not be an impediment to research. William Breitbart, chairman of the psychiatry department at Memorial Sloan Kettering Cancer Center, said, "Medical marijuana got its foot in the door by making the appeal that cancer patients are suffering, they're near death, so for compassionate purposes, let's make it available. And then you're able to extend this drug to other purposes." Guy Goodwin, who was otherwise supportive of the research, echoed this idea. Unfortunately, it is also obvious that legalization for medical use could be a route that works, as it has for cannabis, as a gateway to wider access for recreational use, as if that would be a terrible outcome. These studies lay the foundation for pursuing Phase 3 clinical trials, which will include hundreds of participants from more diverse backgrounds. George Greer, medical director of the Hefter Research Institute, which funded the studies, believes an expansion of the research will occur. What I can say is this: we expect the FDA's assessment of psilocybin to move forward. As the research evidence grows on psilocybin's safety and effectiveness, we think the FDA will want to learn more, and the process for helping cancer patients with depression and anxiety will continue to advance. Stephen Ross, leader of the NYU study, has a lot of plans for the future of research, not only with psilocybin, but with many other psychoactives. Even though our two trials together replicated the same study and would lead one to think this is a real effect, it needs to be done in a larger, nationally representative cancer sample. And if that trial shows what we showed, then psilocybin potentially could be rescheduled to become a prescription medication for cancer-related anxiety and depression. Ross says they're moving towards a Phase 3 trial. A team at NYU is also working to establish an academically based psychedelic research center, which will be the first of its kind in the US. They hope to study psilocybin, LSD, DMT, iboga, mescaline, MDMA, harmine, ketamine, scopolamine, and others. The psilocybin trials alone may cover addiction, anorexia, OCD, generalized anxiety disorder, PTSD, antisocial personality disorder, and criminal recidivism. Ross has also discussed family therapy, group therapy, couples therapy, psilocybin use in the training of psychoanalysts, and various trials to see if psychedelics can impact spirituality, meditation, and creativity. Obviously, these goals are ambitious, and it will take a lot of approvals and funding for the studies to occur, but it's nice there are teams dedicated to truly investigating hallucinogens. If you want to learn more, you can visit the TDC page below. It includes responses from the medical community, more information about the results, relevant links, and other supplementary content. As always, if you would like to support drug education, please consider donating on Patreon at patreon.com/thedrugclassroom. You can contact me at seth@thedrugclassroom.com or on Twitter at Seth A. Fitzgerald.